Hello, everyone. I'm Ron Rolfing, your host of the ACAP Preferred Education Series, and I'd like to welcome you to our latest session presented by Clarity. Our presenters are Eileen Cianciolo, Chief Product and Innovation Officer, and Annie Donaldson, Director of Key Accounts. And they are presenting 3 experiences to prioritize in 2025, retaining members now that open enrollment is over. But before I turn it over, I do have a few housekeeping items I need to take care of. This webinar, along with all ACAP calls and webinars, will be held in accordance with the ACAP antitrust guidelines, and these guidelines can be viewed on our website. We will be recording today's call, and we'll post the slide deck and recording on our website by tomorrow morning. And the link to these items can be found in the invitation sent to you for this webinar. And please remember, if your plan is looking for a vendor, be sure to check out our list of preferred vendors on our website. Just look to the top of our homepage and click on the preferred vendors link. You can also post an inquiry on RFI, an RFP on the preferred vendor connection portal. And during today's session, you can ask a question at any time. And you do this by clicking the Q&A icon in your Zoom window and typing in your question. Now I'll pass it to Eileen and Sarah to get started.
Wonderful. Well, thank you very much for that, Ron. And we can go ahead and go on to the next slide, please. So you'll probably look at our video and our pictures and say, well, that doesn't look like Sarah. Annie doesn't. So just wanted to let you know, Sarah is due next week, and she thought she'd be able to make it through this webinar, and Annie got tapped on the shoulder at the last minute, so thank you, Annie, for your flexibility, but super excited though for Sarah and her journey. So just a little bit real quick, my name is Eileen Cianciolo. As Ron mentioned, I am the Chief Product and Innovation Officer here at Clarity. I've been here for going on 2 years, but I've been in the healthcare industry for, I just kind of stopped counting it, just saying 25 plus years, and we'll just leave it at that. I specialized in and spent my career around member engagement and care management and analytics and using data to drive member experience and engagement. So thrilled to be able to be here with you this afternoon. So I'll hand it over to Annie.
Thanks, Eileen. So as she said, my name is not Sarah Riley. I'm Annie Donaldson, and I'm the Director of Key Accounts here at Clarity. I have been with Clarity for, I think, 4 years. It all starts to run together, but have been in the healthcare industry for almost 20 years. I can't believe it, but happy to be here and look forward to our discussion today.
Great, wonderful. So just as if we go on to the next slide, so just real quickly, a little bit about what we're going to be chatting about this afternoon and spend a little time on is really looking at, now that open enrollment, it's obviously a very busy time for so many of us. And now that we're able to kind of lift our heads up from that and take a bit of a breath, we don't have too much time, right, before we really start to look at, what the trends are that are happening within healthcare and what we can learn from the 2025 open enrollment season. And then how do we prioritize based upon the information and what we see in the trends and where things are going in healthcare? How can we prioritize those experiences, and really looking at what some of the CMS requirements are and how that changes. So not too much of a breather that we get. And then what are some of the actionable how-tos that you can do, just some tactics. And we're just gonna be talking about some of the things that we're doing here at Clarity that I'm really focusing on ways to improve the overall member experience and then which ultimately we know leads to satisfaction for members and retention. So I'm gonna go on to the next slide, and I think then Annie's gonna take over and do the Clarity overview.
Yeah, thanks, Eileen. So a little bit about Clarity. We were founded in 2007 in Madison, Connecticut. We're still there today. Our print facility is actually down the street in Stratford, Connecticut. But a little bit about us, we are dedicated to healthcare communication. We have a healthcare engagement platform. We partner with over 100 healthcare clients and our health plans. And we have engaged with over 143 million members. Some of our clients are listed below, just a small sampling. As I mentioned, we've got over 100 health plans that we service every day. As I mentioned, we are 100% dedicated to healthcare materials. So from clients to members, you name it, we can do it. They're 100% customizable. So from member onboarding, we can do ID cards, welcome letters, member kits, member guides, all the things. We can also handle your post-claim documents like EOBs, EOPs, and checks. And then, of course, your regulatory documents like 1095s, ANOCs, all of those fun things. Most recently, the M3P, Medicare Prescription Payment Plan, that went out late last year. We handled that with no problem at all. So additionally, we have correspondence outside of all of those norms that could be just about anything. As an example, renewal letters. So individual members that are on individual plans, we can do renewal letters and invoices for them, as well as your client groups. So whether you've got, a small group segment that you need to send renewal letters out to, or even your largest group. So all the things, if you can think of it, chances are we can probably do it. So, Eileen,
Okay,
to talk
thanks for
about
that.
our trends.
Yeah, thanks, Annie. So just to spend a little bit of time going into some of the trends that we're seeing in healthcare, and these are, trust me, just a few. There's many, many more that are experiencing daily, and looking to see what changes may be happening with regulations from CMS. But what did we see coming out really of open enrollment? Some pretty incredible stats that I think are really important. So the record breaking, right, high for marketplace enrollment. So that 24.2 million Americans that enrolled in the ACA marketplace for 2025, that's a significant number. It's over 3.9 million more than for 2024. Right. And that's a 50% increase that we've seen in ACA marketplace enrollment from 2021 to 2025. Right. But that's wonderful. There's more people that are receiving healthcare in that way that's available to them. But we also know that the ACA, the marketplace, the tax credit, right, that really enables people to purchase that coverage expires at the end of 2025. And, unless Congress decides to either permanently or just extend, that's a huge impact that could happen. So it's something for AB to absolutely keep an eye on of with the changes that are made there. And then Medicare, we know Medicare enrollment has been consistently, steadily increasing 7 to 8%. We know that there's more and more that are reaching the retirement age, and that's really equating right to around 2 million lives, roughly 2 million additional lives that are coming into Medicare Advantage. And 2/3 of those members, those Medicare enrollees, right, are able to they're part of the individual plans in which they can switch coverage at any point in time, right? Every single year they can change and to select amongst now 43 different Medicare Advantage options that they're able to make that choice from and to select from. And that's pretty significant because, right, we're all Medicare Advantage plans are competing for those individuals. And then from and this is a mouthful, we love our acronyms in healthcare, I know. The ICHRAs, which is Individual Coverage Health Reimbursement Arrangements, we're really seeing a significant increase at 29% from 23 to 24, right? And that's for small and large employers that are really being able to have a stipend really of dollars that are able for the employees to be able to use to make selections that they feel are best for them individually around healthcare. And so, we're seeing that increase more and more. So all of these different choices, different trends impact us in healthcare. And we'll talk a little bit more as we go on about how they impact us. So, right, we know that, and retention is obviously critical. And why is it so important? Right? Well, it's because we want to be able to get the members into the plans that we have. We want to be able to keep them, and we want to be able to keep them happy. And we know that they have the ability to be able to shop for coverage. They can leave, right? And that there is a significant amount of cost when any member switches. Right? We call it a member acquisition cost, right? But it's really what it is it costs us when we have somebody who joins a plan who's new, when we lose them, it's anywhere upwards of $200 to $800 is what's estimated as far as the cost of somebody who leaves. And that, when you take that and you extrapolate that out to 5,000 members, it's a significant dollar amount. But that's only one piece of the impact to really the bottom line for health insurers. It's also the fact that we know the Medicare Advantage from a perspective of quality scores, that retention is critical. And just to emphasize how critical, right? In order to achieve the 4 stars, which, it's difficult enough to achieve 4 stars, much less that means 18% or less of voluntary member disenrollment. Okay? That's not that easy to achieve, and then to maintain on an annual basis. Right? You can't stop your efforts. It's an ongoing continuation of trying to find ways to improve the member experience and retain those individuals. To achieve a 5 stars, which is extremely difficult, but also has a significant impact on bonus payments. 10% or less voluntary member disenrollment. That is very challenging. And like I said, it's not a one and done thing. It's a constant for all members every year of how to be able to make sure that you're really, retaining them, and really looking at what their overall member experience is and how you can improve on it. So, and then, that we know that coverage continuity leads to better outcomes. When you have a member who's part of your plan for a longer time period, you have more time to be able to establish a relationship, get them to trust you, improve their experience, and have a higher chance that they're actually then going to be able to stay. But that takes time. And so there really isn't any time to waste, because members are coming in, new members every single year, and you want to be able to do everything you can to keep them. So as we go on to the next slide, so just to sum that up, better experiences lead to happier, healthier, more loyal members. And I know that in all of the acronyms and all of the bonus payments and retention and the terms, what it comes down to is that there's individuals behind all of this. And if we can really do what we can to be able to get to know them and show that we know them and personalize things towards them, that it results in satisfaction, that then results in retention. And so there's many benefits that come from the health plan and payers from that, but behind it is an individual that feels very satisfied and is getting the care that they need and getting the experience from the health plan that they really desire. So as we go on to the next slide. So what do consumers want? Well, I know all of you know these names up here, and I'm sure all of you have, pretty high probability, all of you have used them. And all of you know that the more that you use them and the more that it really starts to understand and recommend things for you. I love it when Netflix recommends something for me based upon what my viewing history is. And then when I watch that and it's something that I really like, there is a sense of really understanding my behavior and what I want, and then customizing, right, my experience based upon that. That's not new. These are definitely companies that do it extremely well. And yeah, it's very convenient, right? Convenience is a key point. Easy to use, right? Personalized, right? But when we really look at how we stack up as an industry, we definitely have some work to do. The 65% of health plan members expect more convenient experience because they're used to having the experience with other companies that they do, but they're not getting it from healthcare. And 50% of insured adults find it difficult to understand their insurance. As much as we try, and we really try really hard to try to make things as simple as we can. When we really look at it, all of the different terminology that we use and the acronyms that we use, that we think we're being simple and able to understand. But really, when I ask my mom to read something and she reads it and we think we're being clear and she doesn't understand pretty much most of it. Right? There's room for improvement. So, and then 65% of people have had a problem with their health insurance in the past year. And I'm sure I fit within that percent. Right? We just have some work to do. And 75% of US consumers wish their healthcare experience was more personalized. Right? So next slide. What can we kind of Okay, so add on top of that, you've got all these CMS regulatory changes, right? So while of course we want to make things more personalized and we want to be able to improve the experience, but we're constantly having to, and which is just, it's part of it, we're having to react. And a lot of it is reaction to CMS regulatory changes that occur versus like really being able to take a look and instead of reacting, really respond with what's the best experience that we could provide for a member while still meeting these regulatory changes. But that, that we don't always have that luxury really, because they're coming and they're coming quick and we have to figure out how to be able to solve for them. And they will not, this will be continuous. And there's going to be more changes that are going to be coming because there are always changes from CMS that are coming. And so for an example around that, and Annie mentioned this earlier, the M3P payment plan, it is a fantastic benefit for Medicare Advantage members to be able to spread out the cost of their copay over payments over the time period of that year that they're enrolled. But that requires communications to them. It requires an entire setup of how those payments work. There is a significant number of communications that are required for part of that. So always looking at what the regulations are and what the need is. And then really, I would just encourage you to look at your existing vendors and to see where you can leverage communications that are already going out to be able to reinforce any of the regulations around communications such as M3P. Interoperability and patient access is continuing to be a area of focus. We have the CMS interoperability and prior authorization final rule, which is going to require quicker turnaround times. One of the things require quicker turnaround times around utilization management. So, how are you handling that? What is your timeliness around that? And I mean, these are just a few. These are just a few things. There's many more changes that happen in CMS. And so always looking with the eye of how do we turn around and look at this from a member's perspective and how we can communicate in an experience that they're actually going to be able to digest, absorb, and take action on the information that we're providing them. So hence the intersection between regulatory and member experience. So let's go to the next slide. Okay, so what are some of the things that we're looking at for prioritizing in 2025? So again, that all the regulatory requirements, there's no choice there. You have to be on top of those and you have to be able to meet the timelines, or there are usually pretty significant penalties that are tied to that, right? But then how can you take the understanding of those regulatory requirements and ensure the way that you're communicating them, that you are improving the member experience, right? I mean, put yourself in the individual shoes where we all have healthcare insurance. And so how would we want to be communicated with, or how would our parents or grandparents, want to be communicated with in the experience around taking these regulatory requirements and making them meeting the requirement, but then also meeting the needs of the individual and trying to simplify what is a very complex industry, right? But it is critical because while we live the complexity day in and day out, how do we translate that for our members so that it's something that is simple and understandable? And I just challenge all of us to look at how we can improve upon that, because it is definitely needed and it's important and it does lead to retention and satisfaction. So next slide. Okay, enough for me for there. I'm going to turn back over to Annie and she's going to talk about digital wallet.
Yeah, absolutely. So one of the ways we can better the member experience is with the digital wallet. So let's talk about the different ways we can get an ID card. So first is the tried and true way. We can get it through the mail, we print it, we get the hard copy that everybody loves to have, and it's a sense of security. I know, put it in the wallet, but it's expensive. I would dare to say most health plans are paying far more in postage than the contents that are actually in the envelope. So, and with that, it's not environmentally friendly because of all the paper that we are going through every year. And believe me, I have seen the rolls of paper that we are printing on. So then on top of that, we can do a digital card, which is great. It's less expensive. There's no print, there's no mailing, there's no postage. It's definitely more environmentally friendly, but not, it can be accessed through your website or through a portal like on your phone, on an app. But it requires a little bit of I don't want to say work, but some clicks to get there. You have to register for the portal. You have to log in. You need to find where the ID card lives within the portal. And it's not as easily accessible as the next option, which is digital wallet. I know the world is moving in this direction. I have digital wallet, got it for my credit card, for my boarding passes when I fly. Most recently, a couple weeks ago, my Disney tickets were on there. Everything is electronic and it's right there at our fingertips. So one thing that Clarity is doing, and I know this is not a brand new idea, but one thing that we are able to help with is a digital wallet solution. So definitely more cost effective, easily accessible, environmentally friendly, meets all those things. So let's talk about a little bit more in depth on the digital wallet. Excuse me. So when we look at the digital wallet, Google and Apple both have some set parameters as far as how much information can be on that front side of the digital wallet. But we can customize it with your logo, colors, and then we have 8 labels and values for the front of the card that we can fill in. But what's in those values is up to you, the health plan. So it can be information like a group number, member number. It can be RX bin, the network of providers that member needs to use. All of that information comes from the data file that we're getting to generate a paper ID card. But in this instance, we just put it in the digital wallet version. So we derive that information, put it on the front of this digital wallet. And again, completely customizable. The only restrictions we're in is the amount of fields that we have to fill out on the digital wallet. Now on the back side, we have more real estate. So any information that didn't make it on the front, we can put it on the back. So something like a customer service number, a claims address, maybe even more cost share information that you find valuable, we can put it on there. So a lot of options with the digital wallet. But the last thing is the weedy barcode. So you'll see the barcode on the screen on the front side of the wallet there. And what that is it's information that we've pulled in from the data file that you, the health plan, sends us. And it has all of the member information on it. That when a member goes to a provider or even the hospital and that code is scanned, it gives them all of their benefit information, just like anything that we have on the file, basically. So we can have cost share information, deductibles, maximums, again, network, group number, all the things. And that's scannable at the doctor's office or the hospital, like I said. So just another benefit that we can use the data that we're being sent anyways and put it there on the digital wallet.
Great. Thank you, Annie. I'm going to take this next section here and talk a little bit about data-driven communications. So we know, right, that 80% of members prefer digital communications and to be able to interact, but we also know that that's not the actual reality of how many are communicated by digital communications, right? Because of the challenges is that you've got to have the valid information. Right? That is absolutely probably the biggest challenge, is being able to get and receive permission and opt-ins in order to be able to reach out via email. So it's while there's a disconnect here because they want to be able to be people want to be communicated by digital and through email, and yet the actual reality is the number that we actually communicate through digital and through email is a lot smaller. And so how can we really bridge that gap? So if we go on to the next slide. Right, so some of the things that we're doing, capturing preferences is critical. I mean, you all know that you've got to be able to actually get their email and have them opt in to say how they want to be communicated and what they want to be communicated to via email, because it may not be everything. Right, so being able to have a preference portal or a preference option to be able to have them opt in is really critical. But then it's using it in an intelligent way, right? So then consistently being able to reach out and to communicate with what types of correspondence that they want via email. So it's critical, like their core communications, that you really prioritize which of those touch points that they receive and when via that whole digital experience. So there's multiple ways. There's not just email. I mean, email is a great way to be able to communicate to an individual, to tell them, provide them with information, to point them to their portal, that let them know that their ID card is available, that their EOB is available, right? The regulatory communications, but it's also too, sometimes that also needs to be reinforced with other modes of communication. So while that digital experience is critical, it's also important to be able to switch between, right, different types of communications for them. So some people will want certain communications like their ID card, and they may want that reminder via email, but they may want their EOBs going via mail, right? It just, one preference doesn't fit all needs for even a member. And so there's also that next best action reminder. So we're going to talk a little bit later on in this presentation about program design, but I really want to emphasize that you leverage not only the digital communications that you can, but leverage the communications that you're sending out in a way to be able to drive what a next action is. You don't just look at it as I'm checking off the box that I've sent my ID card and the member guide. Really look at how we can utilize and customize that experience to be able to remind an individual of what's the next action that you want to be able to take. And that may just be a reminder via email. So it is a combination. You have to be able to have the digital capabilities. You got to be able to gather the preferences, but you got to be flexible enough to where you can shift between different modes of communication based upon how that member wants to receive it and when. So if we go to the next slide, it's just an illustrative journey, right, of a Medicare member, and really leveraging, for example, you're already sending out an ID card and a welcome letter, right? So how can you use that real estate, right, to be able to reinforce what's next for Amelia? Maybe she's already registered on the portal. So don't just send everyone a portal registration when you already know certain people are registered, right? And then use intermingle with those core communications reminders via the methods of which you've captured their preference and how they want to be communicated with a text. Use your for your gaps in care, your caller cancel screening, being able to time that of when the delivery is going to go out, how many days you're going to wait in between so that you're not causing abrasion for that member. So our platform really supports those different reminders with email and text that are kind of woven into the overall journey of all the core communications that are sent out. So there are a lot of communications that you send, and what we're really saying is combine together the communications and leverage them for what the priority is of what you want an individual to do, and then ensure that it's in the multi-channel approach that meets all the members' needs to drive that overall engagement. So if we go to the next slide. Okay, I think I have this section too. All right, so next best action. I know you've probably all heard that before, and it's been used multiple times, but in the industry. But I really think that we've got this one, in the fact that we cover, as Annie showed earlier, so many of what we call core communications that are being sent out to members. Right, and they really are looked at a lot of times like a check the box. We know we have to send EOBs, so we're going to send our EOBs out. We know we need to send our ID card, right? Versus collectively looking at the overall experience of that member and that journey throughout those communications. Because we also have a separate set within the health plans, that it is focused on, like the star ratings, like we talked about, the quality, Medicaid, Medicare Advantage, right? And there are multiple different objectives that they're trying to achieve. There are so many different gaps in care that need to be gaps that need to be closed in order to be able to either for pay for performance measures or for quality, for your gap in care, for your bonus reimbursements. And usually those areas are looking separately at what communications that need to be sent out, and they're sending communications out. But really being able to connect that together, and like I said, really look at the journey of the overall member and what the touch points are, and really importantly, how you can leverage those core communications that are being sent out with the objectives that you have around next best action, whether it is sign up for digital, register for a portal, someone with diabetes entering into a diabetes management program, getting your mammogram completed. I mean, there's a whole long list of things that health plans are trying to encourage members to actions to take with many different nudges. Combine it together, get the most that you can out of the communications that you are sending out with a coordinated effort that really connects that experience together for the member. But also, it helps impact reduce the amount of dollars that are spent on communications. If you can leverage ones that you're already spending, you're already doing, so leverage them and then supplement it together, looking at that holistic journey. So the next slide. These are just an example. I mean, I could probably create just an unlimited number of objectives here because of what I just listed through. For Medicaid, there's pay-for-performance measures. For Medicare, there are gap in care measures and STAR measures, and there's other. The fact that people have conditions and you're trying to get them into your vendors, that you spend a lot of money, and we know that help people when they can actually enroll in programs, but we know that getting them enrolled is the biggest challenge, right? So medication adherence, nothing new there. We know that people, if they stay on their medications, there's a higher chance that they're actually going to, continue to manage whatever condition that they have that they're taking the medication for. And then too, understanding the access to care, right? People who leverage infrequent, frequent flyers for the emergency room, where maybe there's urgent care that they could be going to. They need to know that information. And so how do you prioritize what your objectives are for a specific population, right? For a specific individual, prioritize those, and then use that prioritization and weave that into all of your communications, right? So if you have a brand new member that's coming in and you want them to sign up for digital adoption and for the portal, have that be top priority. You want to capture their preferences at that point in time. You'd really like to be able to ask them some questions about their health and or their barriers to care, right? So that then you can use that information and go on to the next, so that then the next communication that they get, for example, like an EOB, is what's the next step that you want them to take, versus repeating again, register for the portal when they've already done it. That doesn't personalize that experience, like what we talked about, previously, of what members want. So, and I know everyone on this phone call, the organization that you work for, has objectives that you are trying to achieve for specific populations. And you are all sending out materials that are part of your regulatory or core communications. And if you put that together and leverage them and use data in an intelligent way to really personalize that journey for the individual, right? You're already sending all these out. Just coordinate it. Right? So next slide is just an example. Like I said, this is a Medicare one. They're Medicaid, the commercial, marketplace, right? Everyone has different objectives, but really kind of they are somewhat similar in that you're trying to ensure that members are taking actions that help them live the healthiest life that they can, based upon the information that we have, right? And so those flows are different. So, some you'll have the email and communications for, and they've already opted in. Communicate to them digitally. I mean, non-digital, what's the priority that you want them to achieve? Let's see if we can't get them to sign up for digital, but they may not. And so continue on with mail, but use the different priorities of actions of what's next on the communication. Getting an annual wellness visit or an in-home visit for Medicare, is critical and feeds into the overall STAR ratings and measures. Someone who goes and has on their EOB that they had a MRI, of their hip, right? Have that QR code on that communication link to how they would sign up for a MSK management program. Right? I mean, those really the different experience flows here are pretty endless, but it is like, and sometimes it can be overwhelming. It's like, oh my gosh, where am I going to start with this? Start with the first step, gather email and preferences and digital adoption, and add just another action. Then you can, then you can add, more and more as you go on. But this is very, very attainable, and it also does personalize for the individuals, their communication and their experience, giving them a next action that we think is most relevant to them, right? And then being able to monitor it and to see how well it's working and adjust it as we go forward. So I highly encourage you that this is something we can do, but if you don't do it with clarity, like, go to your vendors and ask them for this, because you are sending out the communications, you're spending the money, optimize it and personalize it. And it's very, very achievable. And it makes a big difference for members, without a doubt. So next slide. This is just an example, right, of your EOBs. Any of you who are, have this as part of your responsibility or within your organization, there are millions and millions of EOBs that go out for individuals. The opportunity on an EOB to get someone's attention, right? They are paying attention. People do pay attention to EOBs. They want to know how much was charged, how much was covered, and how much responsibility they will have, right? Leverage that. Have it be as simple of an experience as you can. I know you may say EOB simple, haha, right? I mean, there's a lot of complexity in it, but you can be able to very clearly put a personalized QR code on that is just for Eileen, that takes you to where you want Eileen to go next, right? And you can change that. Use the data on your EOB, use the landscape on it to be able to then connect people with the information that they need, that you think that will help them at the next step in their health, right? So next slide, I think. That thought there was another slide. Well, there we go. All right, I know that was there's a lot of information. But so really just to kind of to sum it up, we have a lot of regulatory changes that are coming our way. We want to do what we can to improve the member experience, and always look at how we can use the communications that we're sending out and how we can prioritize them. If you don't have digital wallet, you should, because that's the direction it's heading. And I know you may say, well, there's not huge adoption yet with providers, and that's right, there isn't. However, that is coming more and more, especially with the some of the access regulations that we talked about. So it will get there, and we'll be ready for that. And then use your data. You have a lot of data and information. Those EOBs contain a significant amount of very valuable data around what an individual is, the care that they're receiving. And you can use that, right, in real time to drive what that communication is on that EOB. Right? And put it all together, prioritize with next best actions, incorporate it in, and leverage those core communications and the costs that you're already incurring there to really connect this all together. And just doing that will help improve the member experience, without a doubt. So, and I think that's it for us, except we have Q&A. So looks like there's one.
Yep.
Okay.
I have it here for you. Does a plan need to have a member portal in order to use some of the services Clarity has been sharing in this webinar?
Absolutely not.
It says
No.
my plan, Hennepin Health, doesn't currently have a member portal, but we're planning to write an RFP for one.
Yeah. No. No, you don't have to have a portal really at all for this. And looking at a lot of plans do. It's great that you're going out to RFP for one, but really, honestly, what we have seen is that portal adoption it's a challenge, and it is fairly low in healthcare and for health plans, right? Because there's just the challenge of getting somebody to, and that anytime you got to go somewhere and you got to log in, you got to remember your password and get into it, and then how many clicks away is it to get the information that you need, right? If you can simplify Like we will can send like like for example, your EOB's ready, and if someone has opted in and you've captured a preference, which you don't have to have capture that preference through your portal. We have a preference portal that we can use that like QR code. So on a EOB, somebody has gone in for a service for, like I said, for like the MRI on their hip, right? You can scan, we can put a QR code there. That QR code can be scanned and it can take them directly to whether it's a MSK program, or you could have them scan it, sign up for, sign up for digital, provide us your preferences. We
Okay,
can do that on our side with the portal.
there,
So,
our next question. Members say they want more digital experiences, yet adoption has been chronically low year after year. Why do you think this is the case, and what can health plans do about it?
well, I think you've got to have an easy way to be able to capture that preference. Right? If you don't have it and you aren't capturing it right up front. So when somebody first joins a health plan as a new member, it's an ideal opportunity to be able to ask them right away in that initial communication. So when you send their welcome letter that includes their ID card, right, use that QR code individually for them to say, you know, you can either try to move them to the portal to get them to go to the portal, but really you can stop right there and you can say, how do you want to be communicated with, right? Your preferences are important to us, and we want to make sure you're communicated in the way that you want to be. So let us know and provide your email. Well, take that opportunity at the right points with those core communications to and gather the information around preferences. And so you should have that capability, whether it's on your portal or a vendor who is capturing the preferences for you, and then use them. Use them and use them consistently across the board. Right. So if you have captured that for an individual, a health plan has an email address, like that should be a preference. We capture that, we provide it back to you so that you have it and use that permission then to continually communicate with them. Okay, we've got another one. How does Clarity cost compare to member portal cost? Well, it's apples to oranges there, really. If you think about what Clarity does, the ID cards, totally separate than the member portal. The EOBs that we do, any of the communications we send out, it's not the member portal. We don't offer a member portal as far as a product. We can connect to your portal. We have web services and we connect them to web portals like all the time. We connect web services into customer service to see who was sent what when. But we don't do a portal. We do member portal. We do a preference portal, which is really a stopping off period in between directing them like to your portal where we can gather and ask and gather information around their preferences. So really not, we don't have a member portal cost. Great
Yeah,
question. So really appreciate them.
Our next question. Digital is the focus for healthcare based on all the things you've outlined. But what does that mean for print as a way of communication? And how do you view print outreach?
Yeah. Well, this has been a question that we've been kind of dealing with, I think, for my entire career in healthcare, of like, when's print going away? Really? I mean, there's that question's been, and I can tell you that while there is more and more digital communications and you need to be able to support them, print is not going away anytime soon. It's not. I mean, it's required for some compliance communications where you have to send it out, and if you don't have that email and those preferences, you've got to send it out via print. And then there are people that want print, and while some of them are in Medicare Advantage and the older, it's not just that population that we're seeing. It is we had a survey done for some of the younger and the younger generations, and like people had said that they really liked being able to have print, that they felt that print was like something that was really important and really tangible to have in their hands. So it's not going to go away. Someday, I don't know when that someday is. I don't think it's going to be during my career, that's for sure, or maybe not Annie's either. But but you need to be able to address it, and you need to be able to do both, and you need to be able to combine those communications between, print and reinforce with digital and email. So, and we have our own print facility. So I mean, we are obviously very invested in print, but we also do a significant number of web service calls and integrations in email and texts as well, because you've got to be able to do the combination. But having your own print facility helps to be able to. I'm sure all of you who've dealt with a print facility, you know that there's just challenges in being able to get what you need, how you need it. So it's also our platform flexibility of managing all of the different print templates and logos and all of the different content, right? And enabling it through print, but also having it available through web services and or email and text.
Okay, our next question. What are some member acquisition tactics for health plans when people are shopping for coverage? It seems like once they are enrolled, experience seems key for once they're enrolled, but what about getting them to enroll in the first place?
Yeah, yeah. I think might turn that question just a little bit and say, like, keep them. Number one, like, retain them so that you don't have that acquisition cost of like trying to convince them to join the plan. Do everything you can to retain them and to keep them and to build that personalized experience. I think from just a straight acquisition perspective, um, it's I mean, really, it's kind of all over the place because I mean, I'm sure all of you have seen during open enrollment time, especially for Medicare. I mean, there's so many commercials and billboards and they're all around Medicare Advantage, and we think that it's clear to people what Medicare Advantage is and the different options that they have, and it absolutely is not. I say go out and talk to the individuals, talk to the seniors, and ask them. You know, do some testing out there of like, do they really understand it? I've done it multiple times where I've put Medicare Advantage information in front of, my mom or my father-in-law, and they don't understand. They don't understand that Medicare Advantage is even an option, much less which plan to select from. They don't understand what it is, difference from straight Medicare. So I think take a step back, ask the individuals in the markets and listen to them and try to make it as simple as possible so that they truly understand what you're trying to tell them. Sorry,
Okay.
Annie, I don't mean to, I'll give you, I don't mean to take all the questions, Annie.
You're fine.
Oh.
Well, that does
And-
look like it takes care of our questions for today. With that, I'd like to uh, thank Eileen and Annie for a very informative webinar. And also, I'd like to thank all our attendees for taking time out of their day to join us. Just a reminder that the slide deck and recording will be posted on the ACAP website. So thanks a lot for joining us and stay safe.
Yep.
Thanks, everyone.
Thanks, everyone.
Bye.